This presentation is about umbilical cord care and evidence-based practice. My name is Hillary Ratliff. This presentation is a review of literature relating to the use of chlorhexidine versus dry care for umbilical cord care in neonates. The literature covered in this presentation supports the use of chlorhexidine to reduce cord-related adverse events and reduce the time of cord separation. Cord-related events include skin infections with Staphylococcus aureus, erosion, lesion irritation, umbilitis, redness of the navel wall, weeping of the navel, pus, offensive smell, and bleeding of the navel. The first article we are discussing is a randomized control study to compare the efficiency and safety of chlorhexidine versus dry care for umbilical cord care of neonates. The independent variable is the use of chlorhexidine powder for umbilical cord care. The dependent variable is the use of dry care. This article enrolled 669 neonates. Of these, 337 were randomized to receive chlorhexidine powder for umbilical cord care, and 332 to receive dry care. There were a total of 9 cases of umbilitis, 2 in the chlorhexidine group and 7 in the dry care group. Cord separation time was also slightly shorter in the chlorhexidine-treated neonates versus the dry care. Nurses should observe the umbilical cord care of neonates for adverse events and educate the caretakers of umbilical cord care with chlorhexidine. The second article is a randomized controlled trial that focused on the impact of chlorhexidine cleaning of the umbilical cord on cord separation time and neonatal mortality in comparison to dry cord care. The independent variable is the use of chlorhexidine powder for the umbilical cord care, and the dependent variable is the use of dry care. Newborns were randomized into chlorhexidine application and dry care groups. 140 were enrolled and finally analyzed. The time of cord separation, umbilical sepsis, and mortality were measured in both groups. The use of chlorhexidine for umbilical cord care shortens the duration of cord separation and decreases neonatal mortality in the NICU. So in the NICU, nurses can use this simple intervention to be used as a mode for decreasing neonatal mortality. The third article is a meta-analysis literature review that evaluated the efficiency of neonatal cord care with chlorhexidine versus routine or no treatment for prevention of infections in neonates. The independent variable is the use of the chlorhexidine powder for umbilical cord care. The dependent variable is the use of dry care. 12 trials were included in this review. There is some uncertainty as to the effect of chlorhexidine applied to the umbilical cords of newborns in hospital settings on neonatal mortality. The quality of evidence for the effects of the infection are moderate for cord application and low for application to the skin. There is a high quality evidence that chlorhexidine skin or cord care in the community setting results in a 50% reduction in the incidence of umbilitis and 12% reduction on neonatal mortality. The use of chlorhexidine for neonatal umbilical cord care will reduce infections and neonatal mortality. In this review of literature, chlorhexidine was a better choice for umbilical cord care than dry care. The incidence of adverse cord events were less with chlorhexidine than dry care. Cord separation time was also decreased with chlorhexidine. Methods in this presentation included literature review of online articles, meta-analysis reviews of randomized clinical trials, documentation reviews, and patient satisfaction scores. Cord-related adverse events in neonatal umbilical cord care remain a clinical issue. Even in aseptic birth context in a developed country, cord care with chlorhexidine powder showed a reduction of cord-related adverse events. Use of chlorhexidine for umbilical cord care shortens the duration of cord separation and decreases neonatal mortality in the NICU. This simple intervention can be used as a mode for decreasing neonatal mortality. Nursing implications include postpartum education of umbilical cord care practices, use of chlorhexidine in neonatal umbilical cord care within the NICU. In conclusion, chlorhexidine powder for umbilical cord care decreases separation time and reduces the amount of adverse events. Chlorhexidine powder should be applied to the umbilical cord to reduce separation time and decrease incidence of adverse events. Cord-related events include skin infections with Staphylococcus aureus, erosion, lesion, irritation, omphalitis, redness of the navel wall, weeping of the navel, pus, offensive smell, and bleeding of the navel. Here are my references. Thank you for your attention.